Welcome to the Long-Term Care Chronicles Podcast.
Here we are. I'm Helena Nielsen, and I am the chair of Bendale Family Council. I'm also a very pleased executive member of the newly formed Family Councils Collaborative Alliance. And we're here to interview a family member. And I'd like to turn it over to you now. Maybe you can introduce yourself and where your loved one is right now.
My name is Susan Mills. I have a mother that is in the Grove in Arnprior in the long-term care nursing home and has been for 15 months now.
Okay. I have a few questions. Maybe we could deal with those questions first, and then I would very much like to hear, once you've got your responses to the questions, perhaps some comments from you with respect to the newest announcements from the ministry. The first one is, when did you first learn about the virus, that this was a serious pandemic, and also by what means did you learn that we may have a problem?
So I first learned in probably late January when the media started covering it in China. And then it was really more tuning into it when it spread to Italy, Spain, those areas. And it was all through the media.
Well, did you feel that during that time you were given sufficient information and you know, that was shared by our policymakers and from the home? And was it shared basically in a timely manner?
Did not receive any information from the home. It was just all through the media. The only thing that came through the home was just a couple days before we were locked out. Then they put screening protocols in place.
Okay. Well, do you feel that our governments and the home, especially where your mother is, acted quickly once in fact that information was out to contain the virus? Did they act quickly?
I think they could have acted quicker in some respects. I get the initial lockdown. It should probably have been done earlier. And but not only with locking out family, but also with the staff too, working at the different locations. If you're locking out family, then you should have locked down the home totally, as opposed to letting it go on with staffing.
Interesting. Do you feel that our institutions were really equipped to deal with such a serious outbreak?
No. I don't think the pandemic planning that should have been in place was actually in place. Obviously, with the PPE, the infection control, I think the infection control plays a huge part, and also the ward rooms, the 4 to a room, and there's nowhere you could shift anybody. So I think that we had to do better.
Yes. Going back to the testing you were talking about, do you feel that we were testing in a timely manner, both staff and residents, and were the results provided in a timely fashion, in your opinion?
In my opinion, no. No testing was done until early May. So this was March that we were locked out, and so we only started testing early May. The results we were made aware of, but if that's the most vulnerable population, then perhaps testing could have been done earlier.
Mm-hmm. Yes, I think we're hearing that a lot, aren't we?
Yes.
Do you feel that confident that your home had enough staff to care for their residents?
No, because they were short-staffed before. That's why we as family did a lot, and then you're locked out as family caregivers, and they're obviously short-staffed. They have hired 6 new staff. So obviously they were not staffed enough.
So these 6 new staff, were they hired permanently, or are they just on a temporary basis there?
I don't have any information on that. We were just provided a list that they've hired 6 new staff.
Well, this has gone on for quite a while, and as a family member, how have you and your family been coping with the separation of your loved one?
It has been extremely difficult. I do a window visit every day at 10:30. So I go down, stand outside her window, and the staff, who have been very, very, very good with her, they put the phone on speaker, and I just talk to her for a few minutes.
Is she on the ground floor?
She is luckily on the ground floor.
Yes.
But they are building a new home, and most of the residents are on the second floor. So I am lucky in that respect that she is on the ground floor, and it's only like 3 minutes from my house. So, but I have a standing 10:30 appointment with her. I have noticed the deterioration. There is no way they can give the support that the individuals need, because there just is not enough staff. There's not enough activities. The activities, she might get 1 activity a day because they have the group size limited to 5. There's 60 residents. It's a small home, but they don't have enough activities for everyone.
Right.
And it's really heartbreaking.
I can imagine. Like currently, I don't have a family member in the home, but I have some friends in the home, and I'm missing them terribly as well. And, not all have family members to come and visit. And so this is why I've made a point of getting to know some at Bendale that I knew when my mother was there. And so I've tried to keep in touch with them, and it's very difficult for them emotionally. Some of them need that emotional support. And the
emotional psychological with mom. My mom has dementia, so the emotional psychological support is important.
Yes.
They try the technology with my sister, but my mom doesn't recognize my sister anymore, and probably other family members. So,
before we get into what the new announcements are in terms of visitation, from your perspective, having dealt with this now with your mom in the home, have you thought about how we could address this kind of pandemic or outbreak better? What kinds of things should we have in place in order to ensure that we have more staff and consistent staff? Because we know how important it is for our loved ones to have consistency in their care. And, in terms of, how to deal with the visitation and how could that be perhaps done sooner? I understand that with the new visitation regulations, it can't happen in any home that has a current outbreak. So it's only for those that are clean.
Yes, but it doesn't also go, those are social visits. What has been missed in all this is those that were in every single day, like myself, and supported my mother psychologically, emotionally. Some were feeding. I didn't have to feed. I would just slow her down. But those were support visits, which they have done without for 3 months now, going on to 4 months. And to be grouped into social visits as opposed to being an essential visitor, it does nothing for the resident. They need the support, and we're not giving that to them. In terms of staffing, full-time benefits. I mean, not casual all over the place. That's just cost cutting.
Right. And it's also ensuring that there will be a spread of any kind of outbreak, even if it's not pandemic. That if these PSWs, the personal support workers, have to hop from one home to another to make ends meet, to earn a decent salary, then you're assured that you're going to spread any kind of virus or infection. And so this is, this is obviously important, but you were also supporting, like I was when my mother was at the home, is that you're also giving support to the personal support worker by being there. You're then allowing them to maybe spend a little bit more time with someone that doesn't have that kind of support from family. And so you
100%.
were an assistant. Yes. And so it obviously made a difference to the staff not having family members there. So that's...
It definitely did. And so these visitations are, as far as I'm concerned, just PR for the masses and not for the essential persons that were in there supporting. And allowing, like you said, allowing staff to concentrate on others because they knew that you were with your mother or loved one or whomever.
I guess there's a fine balance because obviously they want to keep our loved ones safe. And so they're saying, and like now, of course, with the new regulations, you're going to have to sign a waiver that you haven't been near anybody that has had respiratory problems, that they haven't had COVID, they haven't traveled, and so on. And you're going to have to sign it in order for you to have some visitation with your loved one. I guess that is to ensure the safety of not only your loved one, but of the others in the home. Yeah.
Yes, but they deserve a quality of life and not to be in prison for endless months at a time.
Yes.
I mean, this is long-term care. It's not, they didn't commit a crime, and yet they're behind these cage walls without their support and just wasting away in a lot of cases, maybe depending on the physical or needs, people are fine, but I know specifically for me, my mom isn't.
Would you suggest that people families who could possibly look after their loved one at home during a crisis like this, that they should be encouraged to do so? We understand there will always be residents in a home that cannot go back to their family. They need that constant support from doctors, nurses, and so on, and that families can't look after them. But those that can, would that assist in first of all reducing the number in the home for the staff that are there to look after them, or what suggestions would you have so that you can be that constant support for your loved one during a crisis? Do you have any suggestions for our policymakers?
Yes, I'll address your first question first. Okay. It is very difficult at the stage most of the residents are in long-term care to be able to take them out. I did look into it, but I could not get the support at home because of the medical complexity. And there's shortages. Again, you're going back to shortages because there's shortages in home care. And at the time that they're put into long-term care, there generally have to be a certain criteria medically to be able to be admitted. So it's very difficult to take them out and care for them. And in terms of the suggestions that I have, yes, allow essential and staff in the residence know who were there every day and who supported the residents. So I would say 1 to 2 designated as essential visitors, because they use that term, not caregivers, but essential caregiver visitors to be allowed with proper screening, the same screening the staff goes through, the same PPE, which from my daily visits is only a mask. There's no other PPE because it's not a COVID home. So washing your hands. There's videos too. The Ottawa Hospital has a video for PPE if it ever came to that. What else? Consent form. I agree with that. And if you don't follow, then you lose the privilege of going in there because you're putting other residents at risk. But most family members will follow the guidelines, any guidelines established, because they don't want their loved one or anybody else to get COVID.
So hopefully if this gets out to the policymakers, this suggestion, that maybe that could be one of the things that they're adding to this new visitation suggestion, in terms of your first after the first week after the emergency is declared. Like, as you know, the emergency has been declared until the end of June by our premier. Now, after that, if it's no longer considered an emergency, they're going to start with these visitations. And after the first week, it'll be one visit a week, and after the second, it's going to be two visits, and so on.
Not good enough.
No. Obviously, when you've got somebody who's had a loved one there caring for them every single day, it obviously isn't. And I'm just wondering whether or not they couldn't combine a suggestion like yours with what they're suggesting. Some families don't even have the time, or haven't been there on a daily basis. And so, that might work for them. But for someone like yourself, but for someone like yourself, and there are enough of you out there, that maybe that's another suggestion that they need to take under consideration.
Well, Quebec has a good policy on that, other than the no discretion part. They have a good policy. It's all set up. They were at the table. They had people at the table that pushed for it. And they have the policy all ready there.
You mean taking in your suggestion?
Yeah.
Uh-huh.
Yeah. You don't have to reinvent the wheel. No. It's already there. They've been doing it since mid-May. The only thing is they still allow discretion to the home. And in a lot of cases, in my case, I approached the home. They said no. And in a lot of cases, they will try and keep family out.
Well, of course, I wasn't very, we were all not very pleased to hear that in Quebec they had 25 homes that the military had to go in. And so I am hoping that with their policy that they didn't open too soon. And that's maybe why they have had some problems. Let's just hope that's not the case. But it was very distressing to learn that they had 25 homes. And that was, nearly a week ago now. And we had 5 at the time. I believe we are now at 7 or 8. So it's it really is a very difficult decision, I'm sure, for governments, for policymakers to make. Trying to balance, trying to find that fine balance between your needs, your mom's needs, and of course the needs of all the residents. Because to have 53 deaths in one home that we did at Altamont, it's sad. One staff member of 53 died of COVID in that home.
No, we had another 28 just 15 minutes from here.
Wow, really?
Yeah. And, but you can't fix some of those 4 to a room you're not going to fix.
No. I didn't think that was even possible anymore. I know that in Toronto, our 10 homes, we don't have 4 to a room anymore. They've converted the homes, and we now have maximum 2 to a room, other than your private rooms, but a maximum 2. And so thankfully, here in Toronto, the 10 homes that our city is responsible for only have 2 to a room or 1.
Yeah, it's the same as my mom's facility too. It's 2 to a room or a private room, but there are a number of homes where outbreaks have taken place where there are 4 to a room with just a curtain.
I think, can you comment on what we're reading and learning about the privately run homes? What is the government doing in terms of inspections and ensuring that they comply like our city homes do? It seems like we have a lot of cases and a lot of very disturbing news coming out of private facilities.
Yes. I am lucky in that my mom is in a publicly funded, attached to a hospital, not physically attached to a hospital, but in terms of infection control and et cetera, it's all operated under the same regional health. So I think in terms of infection control, a lot of the privately run probably are not as good. And I'm saying that only because they don't generally have designated people for that. They bring in companies. I'm probably on not quite as stringent a basis as those that are attached to a hospital. And also when you do for profit, cost cutting wherever you can do the dividends and pay the salaries.
Well, even not-for-profit homes. I understand that all the extra monies have to go back into the home. However, we have learned that in the for-profit and non-for-profit, there have been salaries of CEOs and administrators. In one case, over $1 million a year, and another, of course, that might have been the for-profit. But then you have to wonder. Those are some of the homes as well that we heard about a year or so ago, that they were rationing continence. So they weren't changing the residents often enough. They were getting infections and so on because they were rationing them just so that they could make more money. And even for not-for-profit, although the money may go back in, but they have a board of directors and they have to answer, obviously, to their board of directors. And, you don't really have access to the board of directors. So when you've got a concern, if you have a family council in that home, and if you have an administrator that isn't very keen on having a family council in the home, you have no recourse. Where do you go? Because that administrator or CEO answers to the board of directors who you don't have access to. And so they would never hear anything because you have no access. So it's I really think that we need to take a very hard look at our long-term care in this province, whether it's run by the city, the for-profit or not-for-profit. I think we should have the same standards, and I think we should also expect that they meet those standards.
Yes, and inspections can't be said ahead of time or told ahead of time. I mean, that is just ridiculous. Or by the phone. I mean, seriously.
I think the most recent was the optics of one of the homes, and I understand that particular administrator was a former inspector. And so the optics of that was wrong. I think they should have realized that it sent a very disturbing and questionable mindset for all of us. Like, what happened here? Why was it delayed? Why did they remove it from the public domain and then bring it back again with extensions when there were serious problems that needed to be fixed? Yeah. I think those are all things that we need to take into consideration.
We need to take a lot into consideration. This issue has been going on for years. And, families have brought forth a lot of things which have not been looked at. And we really need to
major overhaul.
We need to be better.
Yes. I'd also learned that we don't have a national standard. No. There is no national standard on long-term care throughout the country. That means that if you're in Ontario and you had to move for some reason, and your loved one, has to be in a home in another province, that the standards are not the same. They don't have this similar standards. So you're at the mercy then of the province in terms of what they consider to be acceptable and quality care. I think there should be a national standard, especially since the government, the Canadian government, does give money to the provinces for healthcare. Now, they should want to make sure that the provinces are accountable for that money that they're giving them, or our tax dollars, I should say. We should never talk about government. We should talk about our tax dollars and how our politicians are spending our dollars. They're not giving us anything. They are giving our money away, and we need to hold them accountable.
Yes, while generally provinces are in charge of healthcare, I think what has happened with Ontario, Quebec, is you really do need more of a national standard for this type of thing, because obviously the provinces are not handling it like they should be right now, and in the past, because nothing has been done for years.
That's true. It's been quite a long time.
It's been a long time.
Yeah, I know that I had my dad needed home care. And this was, I guess since 97, 96, 97. And he needed home care, and we got excellent service and home care. Then when my mother needed it, when she was still living with us, and we needed some assistance, by then they had already started reducing the hours that they were giving and so on. And I was very, distressed to see that this was declining, that the service, like to keep our residents, to keep our seniors at home as long as they can be, I think is important, and it would certainly, save money down the road, I think. It
is important, but it has to be done right, because my experience was it was useless. It did nothing to keep her at home. And, Yeah.
Well, of course, when you have that issue, that's a difficult one. But if it's just a matter of needing some assistance, it might work if they were to give the hours that an individual needs. But they weren't. They were cutting back. Constantly. Yeah. So for the last I would say 17 years, this has been going on. So unfortunately,
yeah.
Is there anything else that you would like to share or add to the discussion?
No, but we really do have to do better, and getting family back in is very important. I realize there's a risk, but these residents have a quality of life that where by now, towards their end of life, they do need family. And I can't stress enough, family, especially those that were in there all the time, they need to be brought back in.
Mm-hmm. Well,
and gradually, let's see how it goes. Bring the most important ones back into the support, and then gradually see how it goes, right?
Mm-hmm. Mm-hmm. Well, let's hope. I mean, I'm sure that you're sharing this with your home and with the powers to be from your home, who they report to. And if when this gets out to the policymakers, let's hope that they're listening. And at least if it doesn't happen this time, I think we're giving them lots of suggestions to have all that in place should this ever happen again.
As long as they listen.
Yes, so long as they're listening, that's the important thing, right?
Yeah.
Well, we can only hope that the right decisions will be made for the benefit of all.
Thank you for listening to today's show. If you have any feedback on any episode or suggestions, please contact us on our social media on Twitter @Family Councils, on Facebook @Family Council Collaborative Alliance, and Instagram @FCCA0020. Thank you again for listening.